crucial for Zambia's national development as it directly impacts the well-being and the productivity of the population. And adequate funding enables the provision of essential healthcare services, infrastructure, development and training of healthcare professionals. This in turn contributes to the improved health outcomes, reduced mortality rates and enhanced economic productivity. Today, we'll look at a very interesting topic, and this is the health sector. We know that the Minister of Finance did present the 2026 budget, which is at 253.1 billion. So today we've decided to look at the health sector. Will the health sector realize its set goals for 2026, looking at the figures that have been allocated in that sector? And to help me discuss this very interesting subject is Dr. Chitalu Chelufya, Member of Parliament for Mansa Central Constituency. Doc, thank you so much for being with us on this platform.
Good morning, and thank you, Person, for having me.
You are chairperson of the parastatal bodies, and before I introduce the next guest, maybe, how has been the interaction with various stakeholders this far in the sector budget analysis?
Well, very informative, and the reforms that Parliament has undertaken clearly are yielding good results in terms of improved engagement of stakeholders and improved submission towards the sector budget analysis.
Okay.
Yeah, as you know, pursuant to Article 202 of the Constitution of Zambia, Chapter 1 of the Laws of Zambia, the Minister of Finance did present the estimates of revenue and expenditure on September 26th. Thereafter, various committees have been delegated to do sector budget analysis. From where we stand as parastatal bodies, we managed to handle Head 7, Auditor General, and Head 10, Zambia Police Service Commission. It's been very, very interesting to engage with stakeholders.
Get to understand and appreciate some of the submissions that you've made. I know your vice, I don't know if you have already presented your submissions to the expanded planning and budget. We'll get back to that later. Joining us on set this morning is Dr. Shelen Desai, who is a private practitioner, entrepreneur, and he is the president of the Healthcare Federation of Zambia. Doc, good to see you this morning here on Parliament Radio and Parliament Television. How is the private sector in terms of in the health sector?
Morning, President, and thank you for having me here. It's a privilege. The private health space is growing and improving, and it is definitely becoming the partner that is needed for the growth of the health space and provision of quality healthcare to achieve UHC, universal health coverage. So the private sector is definitely improving in Zambia.
Okay.
Yeah.
Not too long ago, the Minister of Finance was here at Parliament buildings and presented the 253.1 billion kwacha budget. How did the private sector receive those pronouncements? Before I get to Dr. Chelufya.
I think first and foremost, we must applaud the government for increasing the total figure of the budget from 2025 to now. In real terms, there is actually a slight reduction of from 10.7 to 10.3. But nevertheless, it is a step in the right direction. That absolute terms, the figure has gone up. And we believe that as the budget is increasing, the provision of healthcare will improve in all sorts of areas. And the private sector, remember, is complementary. We are basically children of the same father. For us as a federation, we don't like separating private and public health sector. It is unlike any other industry. We belong to the Ministry of Health, which is government. We are regulated by the Ministry of Health. So we complement, and we must follow everything that happens through the government. So the new budget is definitely something that we applaud. Slight reduction. We are not reaching the 15% Abuja declaration. So we keep on asking government to really commit themselves to that 15%. I think my final statement on the budget is it's well and good that there is this budget figure, but dissemination and utilization of the figure is also very important. So I think that is the phase that we need to start getting into very quickly, that it is disseminated for the right purpose at the right time, and it is utilized by the entities that need to utilize it appropriately, ultimately to deliver the healthcare to the Zambian people.
I should also make mention that my sign language interpreter is Chola Kauma, and if you wish to be part and parcel of today's presentation of the 2026 post-budget analysis, the number that we'll be using is 0978 772801. That's 0978 772801. Keep sending those text messages if you have any question or concern. Those are the numbers that you can utilize. Remember, we are both live on television and radio. And we're also on our socials, the National Assembly of Zambia Facebook page, and on our YouTube. Doc, you are former Minister of Health, and these are issues that you were interrogating when you were Minister of Finance back then. How?
I wish I was Minister of Finance back then.
Oh, Minister of Health.
Yes.
Yeah, Minister of Health. But the budget was presented by the Minister of Finance, which is paged at 253.1 billion kwacha. What do you make of these figures?
Well, I should state that the budget increase to 253 billion kwacha for the year 2026 is a statement of intent of government to scale funding for development. However, I must state quickly that we have seen that social sector spending has reduced minimally, and I must sympathize with him that he has to manage the fiscus, but in the face of fiscal consolidation, it's important to spare social spending. If you look at the theme of the budget this year, he focused on consolidating economic and social gains. Now, this is a transition from the previous year's theme that looked at promoting inclusive or inducing resilience for inclusive economic growth and protecting livelihoods. So today with this theme, it signals recovery and now consolidating the gains. But when we unzip the numbers, you could tell that social spending has reduced in key sectors. While we talk of an increase in the health budget, as my colleague, former classmate, Shailene says, while the budget has increased nominally from 23.1 billion to 26.1 billion, the budget share itself has reduced from 10.7 to 10.3. That is not a good signal. Critically, we must state that Zambia's intention in the health sector was clearly spelled out by the President of the Republic when he addressed the nation during the SONA. It was succinctly put: universal health coverage. Now, if you speak universal health coverage, you must speak to healthcare financing. So we expected the budget to be very, very ambitious on healthcare financing. However, we don't see the aggression. We don't see the resonance between the statement to achieve universal health coverage and the funding allocation. One, even if you have to look at the constrained fiscal space, we expected to see revitalization of NIMA, which is an innovative healthcare financing tool that could actually provide relief on the fiscus. We expected to see or to hear statements that sin taxes, whatever collections were being made from sin taxes, would be channeled to health. That would improve healthcare financing. Medical tourism is another opportunity. Zambia has 8 neighbors. It enjoys excellent democratic credentials. It's peaceful. Therefore, we should turn Zambia into a center of excellence for health service provision, combining both our public and private sector infrastructure and services. We could attract the neighborhood to seek services here, and that would improve healthcare financing.
You just talked about the 26.2 billion kwacha, which is allocated to the health sector in the 2026 national budget, which translates to about 10.3%. And it's not meeting like what Dr. Desai talked about, the Abuja declaration, percentage-wise. But how best can the Zambian government utilize this meager amount to make sure that rural areas, because I'm asking this question because you're coming from a rural constituency, which is Mansa Central. How can they be catered for in this 26.2 billion kwacha?
First of all, I would like to look at everyone, everywhere. And that's the statement of intent when you talk of universal health coverage. You would like to have everyone, everywhere having access to health services that are of high quality and that do not cause poverty. In other words, without causing financial stress. So we would like to ensure that that equitable distribution of the resource is assured. So as we talk of rural populations, as we talk about universal health coverage, we need to address inequalities. The budget, it is my sincere hope, will speak to key areas, key pillars of the health system, starting from service delivery pillars to disease indicators, and ensuring that no one is left behind. And critically, also ensuring that we map the country in terms of the epidemiology, so that we are able to apportion resources appropriately to certain rural areas.
Okay.
I say so because if you look at Zambia's triple burden of disease, when you look at the communicable diseases, particularly malaria, HIV and TB, malaria is prevalent mostly in certain parts of the country. We expect to see resources for malaria prevention moving towards elimination in certain areas of the country. But overall, when we talk of equity, we want to ensure that no one is left behind. That's why it's critical, as we talk about universal health coverage, that we map the country sufficiently to understand our epidemiology and be able to put resources where we shall see improved health outcomes everywhere.
Let me bring in Dr. Desai. You coming from the Federation, how will the 10.3% have an impact on the membership of your Federation?
Well, first and foremost, I think when a country makes this budget for the health sector, it's primarily for the public health sector. But being complementary, remember all the programs that are run from the ministry are passed on ultimately to the community. So for us as a private sector, we feel that we have always been ready. So whatever programs are going to be associated, and generated from the ministry, will be well received by us, and we will be partners in making sure that it reaches the last mile. Like Honorable Chilufya has said, that for example, if it's malaria prevention and elimination, where our members are, we are again children of the same father, the Ministry of Health. So ours is always to be partners and complementary, ultimately to reach the citizen of Zambia.
I know the budget is strictly for the public sector, but I'm sure to some extent as the Federation you also do enjoy the NIMA, and I'm sure Dr. Chilufya together with his team back then are the ones that came up with this concept, and you and I had a discussion before we went on set. Very, very important health insurance, which is NIMA. But how have you received some of the changes that have been taking place in the way NIMA is being administered in our country?
Truth be told, I think the first thing we must all agree is the National Health Insurance Scheme run by NIMA is a game changer. This is something all Zambians must accept and enjoy. It is something that we must all propagate and grow. It must never be let to die. I think that statement should be very clear. Nobody in their right mind should allow NIMA to die. Does it have challenges? Massive challenges. The private sector, after a number of years of NIMA being started, were accredited. And there was a simple reason behind it. Let the people choose. Every Zambian must have a choice where they want to go and access their care. So the private sector facilities were accredited all over Zambia. And like any family, you always have a bad seed here and there. But all we hear is the negative things that may happen, and the private sector is always blamed. But nobody's talking about the millions of Zambians that have been accessing healthcare under the National Health Insurance Scheme. So for us, it's a very positive thing. Obviously, over time, there have been a lot of changes. These changes ultimately affect the citizens. So we should start interrogating how many of those citizens have been disenfranchised. You know, they have not received their care because now, for example, dental care, majority of it is being offered from the public health facility. So are those citizens all managing to go to the public healthcare facilities, or what are they doing with their healthcare now? Now, was it the right thing to do? All this stems from, again, is there enough money in the pot? The Honorable Chilufya mentioned sin taxes. We have been crying about this as a private sector. We have presented to Parliamentary Committee on Health several times to say the country needs to design a way of making sure NIMA becomes self-sufficient, right? And there are a lot of studies that have been done by the Zambian government, commissioned by the government, on what sort of monies are available. You know, first and foremost, let us also all agree that healthcare is not cheap. Even just for the public sector to put up an MRI, a CT scan, a cancer hospital, it costs a lot of money. So as Zambians, we must agree that what we are contributing is small, is little.
Okay. Let me bring in Dr. Chilufya. How can NIMA be sustained? I know we've got quite a number of issues that we really need to tackle in the health sector budget, but quickly, maybe under a minute.
First of all, let me make it abundantly clear that if your vision is universal health coverage, simply put, health for everyone, everywhere, the critical pillar you must address is healthcare financing. The critical component of universal health coverage is healthcare financing. Healthcare is expensive, like my colleague has said, and we're talking of healthcare. We're not just talking about treating people when they're ill. We're talking of promoting wellness, preventing diseases, then treating people when they're ill, rehabilitating them, and even offering palliation. So to provide services across this continuum of care, you require resources, sufficient resources. Now we know that the fiscus is limited, and we know that health is competing with other critical areas of our economy. That's the reason why, in our aspiration to improve the health sector, we decided there should be a resilient, a robust, and sustainable way to finance our quest for universal health coverage. Gains have been posted. Today, more than 13.5 million employers are enrolled on NIMA, translating to over 1.3 million people benefiting from NIMA. A shift from 4% of the Zambian population having any form of insurance to over 35%. Access to health services has improved exponentially. Before, the out-of-pocket expenditure was a big hindrance to get health services. But today, people can walk into private hospitals as part of the expansion to access. And that's why I agree with my colleague that, you see, the private sector and the public sector should work together to promote access to quality health services. But the barrier of out-of-pocket expenditure must be addressed, and that's why NIMA comes in. You prepay a little amount and you get access to health services for you and your members of the household. However, we should be very sensitive to what was in the actuarials, various actuarials that we did. And there were milestones that were put in the establishment of NIMA. So to start, when the Act was passed in 2018, Act number 2 of 2018 that established NIMA, there was agreement with various stakeholders, the unions, that we would be deducting 1% basic from the pay of each employee. Now this was on the net pay, and we knew that this was not sufficient going by the
I was
actuarials.
getting to that, because looking at 1% and the challenges that have manifested over the years.
Yes, but if you look at the milestone set, 2 years down the line we're supposed to shift from 1% to 2%, and secondly we're supposed to move from net to gross. There's been consensus with stakeholders. Those who were resisting initially are on board. And if you look at the meetings, the tripartite meetings that government has had, we have on record
I'll request that you're quick on winding up, because we've got quite a number of issues that we really need to talk about, as well as we just don't dwell on NIMA.
So we have consensus that these contributions be increased. Why won't government move quickly and increase, adjust? In other words, to put it succinctly, we need to reform NIMA quickly in alignment with the consensus that has been reached in the various tripartite meetings, and also in alignment to the milestones that were set up.
Being a lawmaker, when are we seeing you maybe pushing the shift in policy or legislation to make sure that whatever those brilliant ideas are actualized, Honorable?
Well, this is year 4. Year 5, no investment in NIMA, no revitalization of NIMA, no reforms in NIMA. That's a bad sign. That is wanton disregard of the fact that healthcare financing is a critical component for the aspiration for universal coverage. So as lawmakers, we've been unanimous. There's been a parliamentary committee on health that looked at NIMA. The suggestions that were put on the table are on the wall for all to see. We've made it very clear year in, year out that we need to revitalize NIMA to ensure that we addressed the issue of healthcare financing. You see, if our people will enjoy high quality health services without catastrophic expenditure, we will need to sit down, promote country dialogue.
You to push in a motion, Honorable.
Well, I hear your in various committees. I've been on the floor. The frustration is these engagements are not translating into action.
Okay. Let's move on to the 30. That's the 953.5 million kwacha, which has been allocated for medical equipment maintenance and procurement. Now the big question is, how would this impact the current state of healthcare infrastructure? Let me begin with in Mansa Central. I'm sure when you go to Levy Hospital, when you go to these level 1 hospitals that we have across the country, even in these district hospitals, the issue to do with medical equipment, MRI not working, the X-ray is down. But the minister in 2026 proposes to spend 953.5 million, which is a good amount, but not enough. How would this impact?
First of all, let's commend the minister for that allocation. Infrastructure medical equipment is a critical component of any functional health system, and we will need to ensure that we not only equip new infrastructure with equipment, we also need to refurbish the equipment in older infrastructure. The only way we will translate this budgetary allocation into improved service delivery is efficient procurement systems, good leadership and governance, for these processes. So we must translate that 935 billion kwacha allocation into improved service delivery by being efficient in our procurement and in our governance of these processes. So I welcome that move, and I say in 2016 to 2021 rather, National Health Strategic Plan, it was very clear that we had intentions to build 6 specialist hospitals, 115 mini hospitals, 650 health posts, and more than 45 district hospitals. Now, government by succession, governance is by perpetual succession. A number of these facilities, yes, were complete and equipped. A number of them not yet completed by 2021. So our expectation is that that money would be used to complete the equipment of infrastructure that was not yet equipped. Because investing in infrastructure without equipping it does not translate into improved service delivery. Challenge of the moment is a lot of infrastructure dotted countrywide, including in Mansa and various parts of the country, but insufficiently equipped. So we need to stop holding capital in buildings that are not providing service delivery. Okay. And as you rightly said, even when we go to high-end health services, specialist health services, look, we should not be queuing for MRIs and CT scans at a few facilities. And government has made progress. In the provincial hospitals, there are CT scans. Maintenance is critical. The MRIs in a few facilities, maintenance is critical. So we need to build on the gains. I spoke of 2017 to 2021 because there are key targets that we set. Some met, some partially met, but with continuity and building on those gains would ensure that 935 million kwacha translates into complete health infrastructure and improved access to health services for all our people.
Okay. Before I bring in Dr. Desai, I know you are a major shareholder when it comes to interacting with government. I'm sure you have these meetings. The 953.5 million kwacha allocated for medical equipment, maintenance and procurement. The question is, how will it impact the current state of healthcare infrastructure? Or maybe the question would be, what kind of advice, as you members of the federation, would you give to the central government, more especially the Minister of Health? But before you respond, let me get to the SMS facility. Remember, the number that we are using is 0978 772801. Let's read some of the text messages that you've been sending on 0978 772801. If you have any question or contribution, that's the number that we are using. Tasila from Muflira writes, Dr. Chilufi and Dr. Desai, it's fascinating to learn that you both studied medicine together. How interesting that you are both here today sharing your experience on healthcare in Zambia. You hinted that you were in the same class. But let's read another text message. There is another one. This one reads, NIMA is a good initiative. If unions can be deducting 2%, then let NIMA also get the same so that services are improved. Kateule Fraser there. Maybe before you respond to those two text messages that we've had, your interaction, you graduated in 1998, you shared the same school at the University of Zambia. Who was the better student?
I should tell you, Shelin was a very smart student.
Okay.
Yeah, and better, I don't know, but he was a very intelligent student.
Which course were you challenged by Dr. Chilufi?
I think we were both doing as best as we could.
That's a clever way.
No, remember, I told you at the beginning that having surnames so close, C and D, we literally from first year up to the time we graduated, were together.
Desai Chilufi.
Yes.
Okay.
So even the tutorial groups we were together. When you went to the years where we have...
So is that the merit, the distinction merit?
Also, our degrees are not classified.
Okay.
Because you can't say doctor, because this doctor got a distinction is better than the other one. It's about how they...
All right, quick response there.
That's why I can survive the question of who was better.
I know, right? I know. But let's quickly, maybe a quick response, or before you respond to the 2%, I know, Doc, it needed to be increasing gradually from the initial 1%. You needed to go to gross. Yeah, maybe. But before you respond, Doc, what best advice can you give the Minister of Finance when he was here at Parliament? Did say that he has allocated 953.5 million kwacha to the health sector for medical equipment maintenance and procurement. Now the question is, how will this impact the shortage of equipment in various health facilities? Maybe your guide as being the president of the federation, and also you are. We should also make mention that you are running Lilai Family Hospital, 3 branches that we have in Lusaka.
Well, I think first and foremost, money will never be enough, but we must always thank whatever we get. So the Minister of Finance giving the 953 million towards infrastructure and equipment should be applauded. For us from the private sector, I always have this statement that I make to colleagues that for us every penny counts and every second counts, right? So the money that has been allocated must be used wisely, number one. That is my advice to the Minister of Health and his team. Wisely by effective procurement, exactly what was said. We have this tendency of thinking that we can only get the best things at the most expensive prices. But we need to make sure we spread that amount wisely and get the best deals for Zambia so that Zambians can benefit. So I would like to see a very open system where the private sector is there to assist. Remember, private sector is not only providing the service as a social service and partnering government in various programs. I mean, like TB, HIV, MCH services, most of these are done at very minimal cost or free, right? But we also make profit. The way we make profit is we make sure we do effective procurement. So we have the expertise. Allow us to assist at no cost, to guide. We have people that have immense experience in how to procure. So my advice still remains, we are complementary. Please do the right thing so the Zambian nationals receive the care that they need all over Zambia. UHC can only be achieved if we look at the person in Kitwe and the person all the way in Gwembe or in Kashikishi. That can only be done if we sit together and apportion this properly and use it wisely. To the people who are going to be using the service, I think this is extremely important. We talk of MRIs and CT scans and X-ray machines or lab equipment. The former minister here has been talking about servicing them. But also the people using them. We have this I don't care attitude, and that's the truth. Because one seems to wonder how a piece of equipment that was bought a year ago starts malfunctioning. Okay. We don't seem to look at basic things like when switching off a machine, how do you turn it off? You know, when there's power surges, do we have a source which can stabilize the power? So I think to the users, we must guard this equipment. The ones that are doing the services, you know, the lab technicians, the radiology technicians, let us guard this equipment. Because ultimately one day you might need those. I tell my friends that a doctor is the only person that every human being will need once in their life. Even if you were never sick, the day you died, who's going to sign your death certificate? It's the doctor.
Okay. Dr. Chilufya, the 2% suggestion that came from one of our text messages?
It's very, very correct. Our contributor is on firm ground, on terra firma, and it's part of the milestones that are in the development plan for NIMA. And I must also state that the unions are in agreement. And if you look at the tripartite agreement, the tripartite meeting held, I think, a year or two ago, it was agreed what needed to be done. government needs to move quickly, translate those agreements into statutory instruments, and move the process. I'm making a clarion call.
Can sort out all the problems.
There are two things there. There is movement from net to basic. That brings in a lot of money, to gross rather. Yeah, that brings in a lot of money. Two, by increasing to 2%, that also improves the collections. Now remember that with insufficient resources, the frustration that comes in is you get to a facility and may not get the service, the right quality of service. And secondly, you frustrate stakeholders because they may not be able to make their claims. So it is important that we address NIMA in terms, look with evidence that is informed evidence from the actuaries, and there's been a lot of progress in terms of stakeholder consensus. Okay. All we need to do is remove the inertia, the inaction. Once things are agreed, let's move. You spoke on something very quickly. I wanted to comment on what Dr. Desai said on equipment. You see, we have the King Solomon Hospital coming up, state-of-the-art facility, will be very well equipped. We've had the privilege of having hospitals like Levy equipped from inception, and many hospitals equipped at Benisho. But we've also had equipment that has just been part of the upgrade, the modernization, as we try to improve cardiology services in the country, renal services in the country, and any other specialized services, be it gastrointestinal. We've invested in equipment. Investing in equipment is one thing. Maintaining it is yet another. At the Invest Teaching Hospital there's a cardiac catheterization laboratory. We're probably one of the few countries in the region to have it. And it is a game changer. We managed to start doing open heart surgeries, closed heart surgeries from there. In addition to what we have at the cardiac hospital there, it's important that government pays particular attention at ensuring that the cardiac catheterization laboratory is serviced and begin to work again. Lives have been saved there. And so we are hopeful that this budgetary allocation will translate into improved service delivery through effective procurement and maintenance.
Let's acknowledge the people that are with us on our social media before we read some of the text messages that we've received. And this one's come from Akalala Mbilila, Katungu Kriston. You are watching us from Sesheke in Western Province, and the care from those professionals in civil service, there is no. Talking about less care in hospitals. The other one comes from Laban Mooks. You are watching from Kabompo, Northwestern Province. Thank you so much. But we'd love you to send us a question or concern regarding the subject that we're looking at, the 2026 national budget in the health sector. And the other one says, I think it's something that you talked about, Doc, where you are talking about you had intentions in the NIMA. It's saying you had intentions. So what happened? That's the question. We had intentions to build. I think it's still waiting for you to conclude some of the intentions that you had regarding NIMA. Also, by Janet Kindolo, all the way from, there's no place where you're sending your text message. You're saying we're following and enjoying the program. Let's read some of the text messages that you've been sending. Remember, the number that we are using is 0978 77 2801. Let's read two text messages that we've received. This one comes from Wilson from Monze Manungu. This program is so important. I'm kindly asking for guidance on NIMA. Is it only for workers or includes those who do not work? Can those who do not work benefit from the schemes of relatives who are working? Thank you so much, Wilson Monze there. Following the program well and enjoying it. Thank you so much. Those are the two text messages that we've received. Maybe a quick response. I know you can, being a lawmaker, I'm sure you can quickly respond to that concern regarding who can benefit to NIMA.
It's for everyone, and we started with the formal sector, where people who were salaried would actually get their deductions at, from the payroll. It was easy to begin. It was expanded to everyone in the informal sector, and even the ordinary person on the street, there is room for you to even just use the gadget to enroll on NIMA. So no one is left behind, and what is important is currently that 1% for those who are employed, plus the 1% that the employer contributes, assures health service for a man, his wife, and his 10, 15 children, as an example. Yeah. For those who are private citizens, there's a figure that you pay. There are some who pay 30 kwacha, there are some who pay a little more, a little less, and all they need to do is visit a NIMA facility or the electronic facilities that have now been introduced, get enrolled into NIMA. There are NIMA officers dotted all over the country who are promoting enrollment, and it's for everyone. That's what's important.
The biggest issue that Zambians are crying for whenever they visit a health facility is lack of medicine in these facilities. But the minister is on record having saying that they've at least attained 80% of essential drugs being available in various health facilities. And the minister's budget speech, did say that of the total allocation to the health sector, 30% has been allocated to increase in the funding for drug procurement. Now the question, maybe I can begin with Dr. Desai. You are coming from a federation and you're a private practitioner. Maybe you interact with these people, especially even patients, because we all share patients. Others will go to the private, others will go to the public health facilities. How will this affect the availability of essential medicines in these public facilities, the 30% increment?
Well, I think first and foremost, once again, there has been an increase in the figure allocated towards procurement of medicine. So that should be applauded. We hope that translates into availability of medication. I think what one must always define is what is essential medication, and the public out there must also understand what is essential medication and what is not, because you always keep on hearing that, oh, we went to the hospital, we were not given the medication. If it's not part of the essential list, remember that the needs of our sector are massive, and from the onset we have said that the money is not enough. So we need to use it wisely. So personally, I think we must allow that this figure that has been given translates into getting the medication to the people, and that starts with efficient procurement, supply chain management, the logistics systems in place. We are always hearing of stocks running out or expiring on us, or theft. Now, digitalization is something that I know the ministry is doing. The government has been rolling that out. But at what point are these gaps? And we need to plug the holes so that the drugs meant for the people get to the people. Again, as a private sector federation, our people are well versed in logistic management systems. Because remember, I would say 99% of the pharmacies, if not 100% of the pharmacies in all towns, are privately run.
Okay, how do you manage having 3 health facilities in Lusaka, issue to do with the availability of medicine? I'm sure there are bad seeds within your organization, but how do you manage to have essential medicines available in all the facilities? Something that maybe people that are running public facilities can learn from you.
Remember the question, the statement I made, every penny counts. So for us it starts from efficient procurement, the right quality at the right price. The people who are selling these products to us, local manufacturers, international companies, will give you the best deals as long as you can pay them. So first and foremost, get the best deal. Once you get the best deal, procure the right amount, store it, make sure you have systems in place. Currently, most of the private facilities of note have got IT infrastructure. So the moment a product comes in, it's logged in the system, the quantities are logged in. Prescriptions are no longer written by paper. If a doctor is prescribing to a patient, he or she will log in to the pharmacy portfolio and say, for example, amoxicillin capsules. It will tell you that it is available or not. When you prescribe 2 strips, it will deduct immediately from central stores. So these things are available. So if us at a small level can be doing it, it should not be difficult for the government. So let's make the systems robust. And again, I call on Zambians. Remember, these are for us. Ultimately, each and every one of us one day might need to be a patient. That is my mantra to my colleagues, that always look at yourself as being on the other side of the chair when you're talking to a client, because you might want to be there. So let's make those systems robust.
We do have a live committee coming up in a short while, so I'm sure we only have about under 5 minutes to conclude today's program. The 30% allocation or increment from the total health budget that the minister presented 2 weeks ago. How will this affect the availability of essential medicine in various health facilities that we have across the country? Maybe just under a minute or so.
Let me commend Honorable Msokotwane. He's been consistent in terms of releasing resources to the Minister of Health, in particular for that cost center medicines. An increment from 4.9 billion to 6.4 billion is a very significant increment, and we have a key pillar in our health systems that we call leadership and governance. Let's have effective leadership for the supply chain, and let's ensure that we build on the digitalization that already commenced to ensure that, one, we are able to do quantification for every product that we need on our essential medicines list, and we're able to timelessly place procurements, pay for them, and also ensure availability of these safe and efficacious drugs at the last mile. Through effective distribution, we have hubs, medical stores hubs, countrywide. That was part of the reform, of the supply chain. So distances have been collapsed. People don't have to move from Kaputa to Lusaka to collect medicines. There's a hub in Mansa. There's a hub in Impika. There's a hub in Choma. There's a hub in Kasempa. So distances that districts have to move to collect these medicines are collapsed. That should translate into availability of medicines. So Minister is commended for that increment. We urge strong leadership and governance for the supply chain to ensure that we have proper quantification, efficient procurement, storage and distribution of these medicines so that our people may have these drugs. Finally, the best feedback on whether we're doing well in the supply chain comes from the patient. You can claim 80% availability. If the client out there is saying we're having too many prescriptions, please pause and have a reality check. Let's promote country dialogue on key issues such as that. Let's not massage our egos with numbers if these are not reconciling with the feedback from the public. In public institutions, we need to have sufficient stocks for medicines to treat common ailments, common communicable diseases, TB, malaria, HIV, even some of the neglected tropical diseases. We need to have sufficient stocks to treat NCDs, commonly hypertension or cardiovascular diseases, diabetes, and other endocrine disorders, cancers. These medicines, we should stock them sufficiently in all our facilities. If we have to expand the essential medicines list, let's do it. Medicine is not static, it's dynamic. We're always introducing new molecules. Let us ensure that we don't stick to old medicines list, because a modern practitioner who prescribe a 4th generation cephalosporin for a particular ailment, having done his own investigations, and if you don't give him access to these, you start having people getting prescriptions. So it's important that we move in tandem in that. And
Doc, I know, we do have a live committee coming up in a few minutes' time. Dr. Desai did talk about pufferage of medicine, which is theft. But again, the minister in his budget address, as we conclude, has allocated 18% of the ministry's health budget, which is about 940.7 million to has been increased to the within the ministry. And how will this translate to improved security and reduced corruption in the health sector? Yeah, just quickly on
the task force that looks at medicine pufferage. That task force has DEC, that's police, SEC, and the Ministry of Health, and ZAMRA. Now, this task force, yes, must be sufficiently resourced to ensure that they can monitor medicines from storage to the last mile, and increasing allocation to them is critical, because then they can actually monitor the movement of medicine, whether digitally or physically, from the storage warehouses to the last mile. So that investment is a critical component, and we must just ensure that we strengthen systems, supply chain systems to support that.
Dr. Desai, as we conclude, how can your federation, being the president, work with the government to ensure that the health sector budget is effectively utilized to improve the health care delivery in our country?
As a federation, our members are spread all over the country. So when this budget translates into programs, we are there as partners, complementary partners. So we are ready to make sure that this budget and its programs that will be initiated are taken down to the people. I would say that the only way this can happen, that the private sector becomes an efficient and effective partner, is that the government, through the Ministry of Health, starts recognizing the private sector as a complementary partner. The problem is, at present, we don't have a very serious engagement platform. So we need dialogue. We need a platform to be created. Some time back, a couple of years back, the then Minister of Health, at the launch of our federation, had suggested and said that it would be imperative that a directorate be created at the Ministry of Health, where this kind of relationship starts getting enhanced. So for us, we are ever ready. We are not on the sidelines, but we are urging the ministry to expedite the process of setting up a platform where we can sit and discuss and be engaged at every point. You see, policy that is created for everybody in this country. So we require to be part of the program when creating policy, not just to rubber stamp that the private sector was invited and they came. Listen to us. We are your children.
I like the appeal there. Before I move to Dr. Chitalu Chilufya, let's just read some few text messages as we conclude, or maybe before we read the text messages, what could be your concluding remarks, Doc, and also to the people of Mansa Central, the people that you've been serving for more than 7 years now?
More than 13 years.
There you go.
Yeah.
I like that.
Yes. The health sector budget has been increased nominally by 13%. We commend the Minister of Finance. Let this budgetary increase translate into improved service delivery for our people. We frown upon the reduction in the budget share, and we must be moving towards a 15% budgetary allocation. Out of the 253 billion total budget sum, 206 billion will be raised from local resources. It means that we need to see aggressive revenue generation measures. That we are not seeing revitalization of NIMA does not speak to our aspiration to increase domestic revenue generation. That must be rethought. Secondly, we need to see investment in primary health care. You see, we do not run a Ministry of Treatment of Diseases. We run a Ministry of Health. We must see sufficient resourcing of primary health care. if we are devolving these primary health services to the Ministry of Local Government, can we see good collaboration? Can we see good policies set and also ensure that there is effective devolution of these services? So for that budget, good allocation, budget share no investment in NIMA is a minus, reduced or insufficient investment in primary health care is not good.
All right, thank you so much, Doc. Let's read some of the text messages that you people, our viewers and our listeners, have been sending. And this one comes from Mumba, all the way from Kitwe. That's Ian. You're saying, don't you think employers are now exploiting employees in the name of NIMA? Because our agreement is that employers should cover medical bills for employees, but they are using NIMA contributions to pay our medical bills. Thank you so much, Ian Mumba from Kitwe there. Simbe also writes that the budget is okay, so buy more aspirin to help BP patients who always have to dip into their pockets to access the drugs. Thank you so much, Simbe, for that proposal there. I think for now, due to time, we'll just read those two text messages. The two doctors, thank you so much for being with us here this morning, and again, share this platform. I'm sure it rekindled the memories that you had back in 1998 at the University of Zambia, graduating as medical students. Thank you so much for waking up early and being with us, Doc.
Thank you so much for having us.
Well, thank you so much for having us. Not 98, we went to campus in 92.
In 98 is when
he had no beard completely. he was so innocent here.
Oh, okay. Yeah. All right. No, the battle won't end here. But Doc, wishing you all the best. I know you are sitting. Yeah, as you continue interlocating the 2026 projections that the Minister of Finance made, and wishing you all the best. And come 23rd, you come back in the House and debate as the expanded Planning and Budgeting Committee will make this recommendation to the main House.
Thank you very much.
All right, so there you have it. That's for today. We were looking at the health sector and just trying to scrutinize the allocation to that sector. And my guest on today's program, I had Dr. Chitalu Chilufya, Member of Parliament for Mansa Central Parliamentary Constituency, and he is the former Minister of Health, and Dr. Shailen Desai, who is a private practitioner, entrepreneur, president of the Healthcare Federation of Zambia. So we were looking at the budgets, the sector, the health sector in the 2026 national budget. My name is Paul Sentindovi, and thank you so much for all you have been following on our social media, and those of you that were listening to us on radio and on television. We'll be back tomorrow. Tomorrow we'll have an interesting topic, but I won't let the cat out of the bag. I'll urge you to be with us tomorrow and listen and follow through what we'll be looking at. God bless, and continue listening and watching Parliament.